Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Brachial fistula. So brachial fistula, it can be unilateral or bilateral. And it arises on the first and second brachial cleft. Next is it is lined by a ciliated columnar epithelium. It presents with a discharge, that is, it can be mucus, or it is MP, that is a mucus purulent. The external orifice, it includes the presence of the lower third of the neck at the anterior border of the sternocleidomastoid. So lower third of the neck, this will be anterior to the SCM, that is the sternocleidomastoid. Next is the internal orifice. So here in the internal orifice, it is behind the tonsil on the anterior part. It is behind the tonsil, and this is on the anterior aspect of the posterior fascial pilus. So in case if the internal aspect ends blindly, it's a brachial sinus. So the internal aspect, it ends blindly. So then it is known as the brachial sinus. So how to treat this brachial fistula? The treatment will be by excision with the multiple transverse incisions. So multiple transverse incisions, and this is nothing but the step ladder pattern. To learn and grow daily like this, please do subscribe.